Well, I want to say hello to all of our listeners out there and welcome to the IRG and Washington Orthopaedics podcast. This podcast, we are going to talk about NFL injuries from the previous week. Our goal is to take the information we have and assess the player's ability to return. What does the rehab look like? Are they going to be back? Are they out for the season? Joining me is Dr. Hawkins. Dr. Hawkins is a very experienced orthopedic surgeon from Washington Orthopaedics in Olympia, and he is going to provide us the orthopedic consultation on the injuries. I'm a physical therapist, and I'm going to talk about the rehab and what physical therapy would do to get these players back to their functional activity. Dr. Hawkins, how are you?
I'm doing outstanding. Thanks for asking.
Yeah, absolutely. Tell our listeners a little about your background. I know that you and I have talked. You have extensive experience in orthopedic sports medicine, have experience in treating these injuries and assessing the player's ability to return to activity. So that's kind of what we're going to do. Maybe just start out and just tell our listeners your practice down there in Olympia, kind of your history, and just give us a little update there.
Absolutely. Yeah, I've been practicing as an orthopedic sports medicine specialist now for 20 years. Spent actually the bulk of my career back on the East Coast. I'm a new transplant out to the Olympia area. I've been here about a year now. Basically my practice has been focused on essentially getting athletes back into playing, recovering from injuries, taking care of everything from your high school and younger athletes through, Division I athletes in college, and then into professional athletes. So I've had the opportunity over the years and my training in New York City to kind of work with, everything up to the highest level of athlete over those last 20 years.
That's great. Well, we're glad to have you. I'm a physical therapist, been practicing for 34 years. I work closely with orthopedic surgeons. My role in physical therapy is to rehab these athletes to get them back to 100% function and return to play. So we're going to get started here. And the first one out of the chute here, so to speak, is on everybody's mind, particularly here in the Puget Sound or the Pacific Northwest. And that is Russell Wilson, quarterback for the Seahawks, sustained what we call, or has been called, a mallet finger. Dr. Hawkins, what is it? How does it happen? How do you treat it? And let's get into that.
Absolutely. Yeah, it's a tough injury because of his position, but essentially what's happened is there's been a trauma that's caused the extensor tendon, so the tendon that helps to fully extend the tip of the finger, to essentially pull off. And they described it in the press as a fracture dislocation, and that's because a lot of times that tendon pulls off with a piece of bone, and how you treat it depends a lot upon, who you're treating and what their goals are. And so, a random normal person probably might not have gotten surgery, but they would have had a very long recovery and would have taken some time to sort of cast it. But Russell's in a place where, his goal is to be back. He's the kind of Iron Man. We all know he hasn't missed any time over the years. And, the right thing to do in his situation, especially with a situation where there's some bone attached, is they can go in there and fix that back. They mentioned putting screws in, which means it's a good size piece of bone. And so that gives it a good chance to heal anatomically, but also be able to start moving it and rehabbing it. And that's why we're seeing some encouraging information about his ability to come back relatively soon from something that kind of looked pretty bad.
Yeah. So, basically what they're doing here is they're fixing that torn ligament tendon, that what we call the extensor hood in that end of that finger. And then they're also repairing that fracture. So he's going to be immobilized for a little while, start some rehab. And are you thinking, from what you know, he is going to be, is this a 6 to 8 week thing?
Yeah, I think that's kind of the classic number you get. What they're going to look at is they're going to look at how his finger responds, meaning, does he have a lot of swelling? Does he have a lot of difficulty getting mobility? It's tough because unfortunately it's on that throwing hand. And we know that when you're throwing the football, that middle finger, every quarterback holds the football a little differently, but usually that's an important one with regards to being able to put pressure onto the ball, to control it, to put spin on it, to put touch on it. So, I think if he's doing well, the fracture's healing, his swelling's going down, his therapists are hitting him, the right way. He gets back at 6 weeks. I think 8 weeks is probably something to not be out of the question either, but he seems a really, really motivated patient.
Yeah, he is. Well, let's hope Russell gets back in 6 to 8 weeks. We definitely love Russell Wilson, what he does and his intensity. And like I said, it's a little bit of a shock for everybody. He is this Iron Man. And then all of a sudden you have this, what seems like a small injury of your finger that can be functionally so dysfunctional for a throwing quarterback, that's for sure. Saquon Barkley, I saw this on TV. I mean, this is a fairly benign injury when you look at it on TV, but a significant injury for a running back. He's stepping on another player's foot. You can see the ankle rolls laterally. He sustained what they're calling a ankle sprain. So let's talk about ankle sprains and that lateral ankle sprain that most likely Saquon Barkley is experiencing.
Absolutely. They've even characterized it and come out and talked about the difference between it being a low versus a high ankle sprain. And so that has a lot to do with that difference in recovery. So with a low ankle sprain, what you're doing is you're stretching or partially tearing the ligaments, the ropes that hold the bones together, but just at the ankle joint. When you get into these high ankle sprains, you're damaging the tissue that actually holds together the two large bones in the lower part of the leg. So that's a much more significant injury. So in his case, I think the confounding variable here, the tough part about it is just that he is coming off of a knee injury. And so the whole idea behind it is he needs a lot of control of all of these joints to be, sort of fully recovered, to have his balance, his proprioception ready. But if his swelling gets down quickly, if they're on top of it, if they protect that ligament, they can wrap him up, they can tape him up. And that's a legitimate situation where 2 to 3 weeks seems pretty reasonable for him to be back.
Yeah, you people in medicine, and I should say us people in medicine, we like to put numbers on things and just tell our listeners, when you look at a sprain, this is an ankle sprain, so you're tearing, like you described, those ropes, those ligaments. Ligaments connect bone to bone on the outside of that ankle, stabilizing that ankle so it doesn't roll out. These are oftentimes graded. And based on the grade, based on the tear, maybe talk about the grading system there that you use as a surgeon to kind of project maybe recovery.
Yeah, essentially you can look at it as like a circle going around the ankle. So most people sprain the front lateral side as you described, and that's sort of the grade 1 injury. And then as it progresses to farther around the outside of the ankle, to the back of the ankle, and then all the way over to the inside, the medial aspect of the ankle, you go to grade 2, grade 3, grade 4. And so in those situations, it's kind of like a chair with 4 legs on it. As you take each leg away, that chair is more and more unstable. And so those situations, you have to protect it longer to let that tissue heal, or even sometimes consider surgery for them as the grading system goes up.
Yeah, and this is a little biology involved here. I mean, the body just has to repair those torn ligaments. From a physical therapy standpoint, if it's non-surgical, we're going to treat this conservative. We're going to work on decreasing swelling, pain, improving range of motion. But, one of the things that you mentioned that's really important that people understand, it's just not tearing the ligaments. It's also interfering with the proprioception. And maybe tell our listeners, kind of that's a big word, and I'm not sure everybody understands proprioception, how important those ligaments, i.e. in that ankle, are for balance and a running back.
Yeah, essentially all of that tissue has nerve fibers in it. So when you stretch or you tear something, you essentially lose the feedback from that. So the same way, somebody who unfortunately has like a major brain injury, like a stroke, they have a hard time recovering balance and things. These are like miniature injuries to that nerve feedback. And so you really have to retrain the body to understand those signals. And that's really where therapy comes in. That's something even as a surgeon, we can hook things back up, but the therapist is incredibly important for that recovery.
Yeah, I'm wondering if, I don't know if you know this or not. I don't know. I mean, was that ankle sprain on the same leg that he sustained the ACL injury? Was it the same limb? Do you know?
Yeah, and that's a great question. I know I know it was his right ankle, but I couldn't remember either whether it was his right knee tore the ACL on.
Yeah, and if that was the same leg, I mean, maybe there is, some return to play, some rehab that's still going on there, and he was maybe susceptible a little bit to that weakness or proprioception or lack of proprioception, just from the standpoint of being non-weight bearing when he was rehabbing his ACL. So it could be in that what we call kinetic chain, but he's most likely out. I would suspect. I mean, you're probably looking at. I heard he's on crutches, so I would imagine it's a grade 2 at least. I'm just guessing here, but probably 6 to 8 weeks. Would you say?
It's interesting that you bring that up. I think he'll be a little sooner. I think that's the average recovery for you and I. I actually had the pleasure of actually knowing Saquon when he was in high school. He's actually from where I am in Pennsylvania.
No. Okay, there you go.
I took care of him when he was in high school. And that kid is an amazing person. It's kind of like the Adrian Peterson example when that gentleman blew his knee out and they thought, hey, this guy's career's over. He rehabbed and he came back and sort of blew everybody away. And Saquon's kind of in that mold. Obviously, every ankle sprain is tough. And every athlete who comes in, I actually tell them, I go, listen, I wish you broke it because then my numbers, my recovery time would be more predictable. With an ankle sprain, you're right. Some of them come in, and if they're not off crutches in a couple weeks, then that's a bad sign. That means things are not going quickly, and they're going to be 6 to 8 weeks. So I think the next week to 10 days is going to really tell us a little more about it.
Well, we're just big shout out and good luck to Saquon Barkley. I mean, coming back from ACL is difficult, but then getting an ankle sprain the following year, I mean, he'll be great. He is an elite athlete. I want to talk to you about Clyde Edwards-Helaire, running back, Kansas City Chiefs. They've been struggling a little bit. I think they've lost, 2 in a row, which is unusual for Kansas City. I mean, this running back goes out, I think, in the second quarter. It sounds like he had an MCL sprain. What is the MCL? What's going on there?
Yeah, so we're back into talking ligaments again, like we were earlier. And so the MCL is the medial collateral ligament, and it's a big, thick ligament on the inside half of the knee that runs from the end of your femur, which is your thigh bone, to the top of the tibia, which is your leg bone. It can be described oftentimes almost like a big, thick piece of duct tape that's strapped from one bone to the other. And if you saw his injury, the poor guy is literally landed on by about 8 guys tackling him. His foot's caught underneath him. He hyperflexes it, bends it, and then he gets twisted as well. And so when you see all that happen, I mean, you think the worst in many different ways. So I think he's lucky that he sprained that ligament. Now, calling it a sprain, back to grading systems, if you partially tear it away from the bone, and back to that example of thinking of it like a piece of duct tape, if you peel that tape away from the bone, but it doesn't actually tear, then just protecting it, it'll stick back down again, it'll heal. And that's what it sounds like he was lucky enough to have happen. But I really thought the worst when I saw the play in slow motion, that he was going to have a more significant injury because of how many people hit him and how his foot was caught underneath him.
Yeah, that force comes from usually the lateral side, forcing the knee to the inside. That MCL, that medial collateral ligament, gets stretched out. Maybe kind of talk to the listeners. Is there a possibility, from an anatomical standpoint, that MCL is connected to that medial meniscus, that bushing inside there? Any chance that is involved? I mean, I know we're just guessing and just chatting here, but maybe talk about the anatomy of that MCL connecting to that neighbor, that medial meniscus.
Yeah. So as you mentioned, the medial meniscus is kind of like a bushing or a shock absorber inside your knee. And it's essentially a soft piece of cartilage, and it abuts or comes up to the undersurface of the meniscus. So, anytime you have that sort of a bend or a twisting motion, there's always that chance that the injury is going to propagate or extend inside. If he's not showing a lot of swelling inside the joint, the good news is that usually means that you don't have that level of an injury. Isolated MCL injuries a lot of times are super painful on that side, but don't necessarily get a lot of swelling inside the joint because the ligament's outside the lining. But that would be a much more problematic thing for him to come back from quickly. And I think the early estimates were that he may be just a few weeks. So I'm thinking that despite how sort of traumatic the injury looked, I think they might have been lucky enough that he just sort of had a grade 1 MCL sprain. And that means that when they stress it, he doesn't show any significant laxity. So when they push on the knee, it doesn't gap or move. It's just painful. So if that's the case, he should be back relatively, within a few weeks.
Yeah. This is the typical injury that you see when, this is an offensive lineman injury. A lot of times it's this pile up, this rollover. The knee gets buckled to the inside. That's why a lot of times on TV you'll see offensive linemen wearing those braces to kind of protect those knees from getting rolled up on. That's what's going on there. So a typical MCL sprain. That MCL protects the medial side. That ligament needs to heal so that running back can cut, stop, shift, which is very important in their position. So you're talking about 2 to 3 weeks, hopefully, with him. Okay.
Yeah. And they don't want to be in a brace. So that's the issue.
Right.
A lineman might come back in a week or two and just put his brace back on. But, again, because those guys play through pain all the time.
Yeah.
But in his case, it's going to compromise his ability. He's a small back with a lot of lateral motion. So he's not, he's going to need to be out of a brace to really be effective. So that'll be the big telling factor for him.
Yeah. I want to throw a kind of a complicated injury at you here as we kind of get ready to wrap up. This has been really fun, by the way. JuJu Smith-Schuster, Pittsburgh Steelers. A big injury for a wide receiver. A shoulder dislocation. Let's talk about that injury and what's going on there.
Yeah, so that's a real tough one, and a lot of the decision-making process comes into, what position you're playing and obviously what sport you're in. We're staying in football today, but the shoulder is inherently a very unstable joint. We oftentimes compare it to, think of a golf ball sitting on a golf tee turned sideways. And so it relies a lot on the soft tissue to help keep the ball centered on the socket. Your hip joint is much different in that the ball fits inside the socket. So anyway, once you dislocate your shoulder, you almost always have some type of an injury. In a younger person who's athletic, oftentimes that's an injury to what most people have heard of it in the press is what's called your labrum, and that's essentially a sort of layer of or edge of cartilage that sticks up, or like a lip essentially around the socket itself. And anyway, that lip can get pulled off or torn away, and you lose some of the concavity or the depth of the socket, and so it's much easier for the ball to pop out. So again, in his position, an offensive lineman could put a brace on, something that would limit his arm from getting too far overhead or pulled behind his back, and try to get back sooner. But with a wide receiver, he has to extend his hand overhead. He's going to get hit. He's going to put his arm out to try to stop himself from coming down. So those are all really worrisome things about whether this is something that can simply be rehabbed, or if he has that degree of an injury, he's just going to get that repaired. Yeah,
it's a significant injury. What I would assume it potentially could be a season-ending injury for him. Now, tell our listeners just the mechanics and just the trauma. You got to understand that ball, you described that ball like a golf ball on a tee. That ball is, traumatically dislocated, slides out from that socket. It's the labrum, it's the tissue around it, it's the intrinsic tissue that supports that hypermobile joint, so to speak. So you're looking at a lot of damage here maybe. And, so it takes some time to rehab this.
Absolutely. And that's the thing, with a pro athlete, if there's a large obvious tear, they'll jump on surgery quickly. If there's a small tear, because there's concerns about losing mobility and stuff with surgery, they may really focus on the rehab side and like you said, end his season, rehab him for 2 to 3 months before making a definite decision about surgery or not. So they're much more unpredictable, and much harder to kind of pull the trigger on those things, because even with surgery, you may make it more stable, but you may also compromise some of his flexibility, which is what's important for his position.
Yeah, a wide receiver, like you said, has to go up overhead, reaching overhead. A lot of times you may see like a linebacker or a lineman. Sometimes on TV, you'll see them, they'll have a brace on that you can see coming out of their shoulder pad and attaches onto their bicep. A lot of times that player maybe has a hypermobile shoulder, had a dislocation. They can wear a brace to kind of help support that joint as it's healing. Wide receiver, totally different story. I would suspect JuJu Smith-Schuster is out for the season. Rob Gronkowski, everybody's wondering about Rob. Tough injury. We're going to wrap up with the tight ends here. he took a significant hit to the chest. I mean, I think he was going up for a ball, and the tackler came in and just really collided with him fairly traumatically. He went down, went to the training room. I think they did x-rays. He's got some rib injuries, super painful injury. The ribs are so important in breathing and just moving. But what's going on here? I mean, is that just kind of a contusion, fracture? I doubt it. But, is he going to come back here soon?
Well, I think you brought up a good point with regards to those rib injuries being tough. I mean, the issue is if you can't breathe or take a deep breath, you can't get hit. Yeah. And so that's really the big problem.
Right. Yeah. Ribs are tough. Again, a lot of biology here, healing time. They're going to get hit again. You can't really protect him. There's not a brace out there. I think he's probably out for another week or so. Just my guess. It takes time for that ribs to heal, and a player needs to be comfortable going back in to be able to sustain a hit and, like you said, breathe. So, we're out of time here. That was a fun 25 minutes or so. We're going to keep an eye on these injuries. We're going to get back together on a weekly basis, go over these. This is kind of our injury update, kind of player sit. And we've reviewed some of your fantasy football athletes, and we will continue to do that in the future. Dr. Hawkins, it's been a pleasure. It's been a lot of fun. Thank you for your time.
Absolutely. This has been great. Thanks so much.
Thanks for listening to the Sports Injury Update Sit or Play podcast, brought to you by IRG Physical and Hand Therapy and Washington Orthopaedic Center. For more information, you can contact us at irgpt.com or waortho.com. That again is irgpt.com or waortho.com. Thanks for listening.
Welcome to IRG's Sports Injury Update. I'm with Shannon O'Kelley, physical therapist and president of IRG Physical and Hand Therapy, and our guest, Dr. Christopher Hawkins, MD, board-certified orthopedist and sports medicine specialist at Washington Orthopaedic Center in Olympia.
Dr. Hawkins, we have a current San Francisco running back with a chipped knee cartilage. What is that?
Essentially, he probably had a contact injury, and when he hit the ground or a player hit him, he knocked off a piece of cartilage, so kind of created like a pothole in his knee.
And what does that look like? Signs and symptoms?
Typically, you're going to have swelling, you're going to have pain, difficulty with motion. If it's a large enough piece, the actual knee may not move normally, so it may block motion of the knee.
Can you have buckling and locking or instability just with that piece of cartilage in that joint?
Absolutely, especially if it gets stuck in the wrong place or if it's rather large.
As an orthopedic surgeon, how are you going to diagnose that?
Typically, you're going to obviously examine him, see about those symptoms we just talked about, but we're obviously going to get an MRI for something like that, especially in a high-level athlete.
High-level athlete. I mean, is there any time where you have to do kind of surgical intervention on that?
Yeah, absolutely. And that's kind of what you run into with his situation. They kind of talked about a short-term recovery, now a much longer recovery. So a lot of that was probably dependent upon his activity level and the type of athlete he is.
How do you repair that divot in that cartilage? Because we know it doesn't repair itself.
Yeah, for someone like you or I, and I'm obviously saying we're weekend warriors, we might just go in and do that short recovery, take the piece out and get back to activity. In his situation, I'm 100% convinced they're doing some type of a cartilage restoration procedure for him.
Return to play?
9 to 12 months, sometimes 18 months for something like that. So that can be quite extensive, hard for the day-to-day person like you or I.
There you go. Everything you need to know about knee cartilage injuries with Dr. Hawkins. For more information, you can contact Dr. Hawkins at waortho.com.
With over 40 neighborhood clinics around Washington, IRG has you covered. Let IRG be your family's physical therapist. Find the location nearest you at irgpt.com. That's IRG.